Good morning, doctor. Today I was thinking about that reticent child, that child who is a little reticent or a lot reticent in terms of having you do things that are part of your dental or orthodontic treatment plan for them. They may be 2 or 3, they may be 5 or 6, they may be 10 or 11. Age does not matter today. Today, children are reticent because they are not used to coping very well. And most children, the majority of children, are going to be pretty hesitant in the dental chair, much more than it used to be years ago when I first started treating children. But the same exact management, if you will, or ways of dealing with the child work today as did before. And that is being absolutely sure that you're going to get it done and having the mom on board with you beside the patient and proceeding and being, for us girls, being a mama, for you men being a daddy. In other words, we're going to do it. You're fine. It's going to be fine. It is fine. You're just conveying such a confidence and such a surety that it'll get done. I don't care if it's an impression for a lingual arch space maintainer or whether it's local anesthetic. You just proceed. Now, again, I recommend mama's right beside you anytime you have a reticent child. Why? Because she can see and appreciate how much you love her child and how determined you are to get it done, and she can feel better. I've said before, and I will say again because I can't say it enough, mama's more scared than the child. And when you say to mama, and usually I kind of half mouth it, half whisper it, this is harder for you, mama, than for your baby. They say, you're right. Understand, they get that. They're more worried about themselves than they are about their baby. I know that sounds funny, but it's the truth because we're human. So what you're doing with having mama there is keeping her more at ease, keeping her more aware of what's going on. The last thing you want is for her to be out in the reception room and hear her child cry or say something, no, don't do that, or whatever it is. If she's right there and sees your response and sees that you're sure and sure-footed and continuing but loving, then she's going to be much better off. So that's one thing. The second thing is being sure-footed, being sure that you'll get it done. Now, one thing I have to say, one caveat, if you have a mama who says, you need to stop, he can't do this, or I can't do this, or please don't, you say, absolutely, and you stop. Why? Because they just pulled consent away from you to do the procedure. It doesn't happen very often, but if it happens, please do what they ask, because legally, ethically, and emotionally, you'll end up being better off. Don't feel rejected. Just understand that mama's really, really scared, and let it be. How do you deal with it after that? Probably not treating that patient. Usually that's a patient and a mom that you can't really handle or deal with or do a good job for. But the bottom line is, I would say 99% of the parents that I've dealt with over the 30 years are going to say, I can't believe how great you are. How do you have the patience? How do you keep going? How do you manage? It's amazing. Thank you. That's what they will say. So the reticent child needs you to be sure-footed, needs you to be, in other words, confident, needs you to be supportive of mom and have her there if at all possible, and proceed and do an excellent job for their child. That's the best I can tell you. I also usually have a head support person in there to help keep that little head from flipping back and forth in its resistance or reticence. But the bottom line is, you can do it. And when mom says no, you stop and say, you're right. Okay, some thoughts for today. Good luck with that patient behavior management because it's more challenging than it used to be. Dr. Chris, signing off.